Well, hello there. I am Dr. Chongo Shapi, a resident general surgeon, and today I would like to discuss diabetes mellitus with you. So the question arises, what is diabetes mellitus? Well, diabetes mellitus is basically a condition in which the body loses its ability to regulate the sugar levels. What does that mean? So what normally happens is when we eat something that contains sugar, the body will break down that sugar so that it's absorbed into the bloodstream. And then in response to that, an organ in the abdomen called the pancreas releases a hormone known as insulin. So insulin then will make sure that the sugar that's in the bloodstream is now delivered to the cells outside the bloodstream, and it can be used for energy. Think of it like a lock and key. So insulin is a key, and the lock is the body itself. So when we eat something that has sugar, insulin will come and act like a key and open the blood vessels so that the sugar can go towards the cell. So insulin opens the key. In type 1 diabetes mellitus, there is no capability of production of insulin by the pancreas. And then it's autoimmune, meaning the body attacks the pancreas and it loses its ability to produce insulin. Type 2, on the other hand, is a lot more common in the older generation. The older you get, the more you're at risk. The other risk factor for type 2 is that it's genetic. If there's a family history of diabetes in your family, maybe your grandmother may have suffered it, then there's a high possibility that you may develop diabetes mellitus type 2. Then the other common risk factors include obesity, a lack of exercise, and bad eating habits. Moving on, the other important thing to discuss are the symptoms of diabetes mellitus. So the most important symptoms are that, number one, there will be an increased urge for thirst. You will be thirsty most of the time and you'd want to rapidly drink a lot of water. The other symptom is that there is increased urination. The frequency to want to pass urine and pass urine will be increased, such that especially at night you wake up to go and pass urine even more than 3 times. And the characteristic feature of this urine is that it will be very, very colorless, just like water. The other symptom is increased appetite. Investigations for diabetes mellitus are basic. So you do what is known as a fasting blood sugar, where the doctor asks you not to eat for a while, and then the sugar levels are tested. Another confirmatory investigation that can be done is what is known as an HbA1c. So in this particular test, it looks at how bad your blood sugar levels have been for over a period of time. The treatment of diabetes mellitus is quite important because it focuses on controlling the amount of sugar that's in the body. If the amount of sugar that's in the body, especially in the bloodstream, is not well regulated, there are so many complications that will come about as a result. So management starts from counseling the type of food that can be eaten. So we have the dietary counseling that is done. The other option is a patient can be asked to start some medication that will help reduce the amount of sugar that's absorbed or the amount of sugar that remains in the bloodstream. The most important complications of diabetes mellitus include everything that comes about as a result of damage due to the raised blood sugar levels. For example, there is damage to the nerves, there is damage to the blood vessels, and there is damage to the heart, there is damage to the brain, there is damage to multiple organs. It's important that one has to go for screening when they meet the criteria of risk factors, so that when a diagnosis is made, a management plan can be made for a particular patient. Screening for diabetes mellitus is free at each and every healthcare facility anywhere in Zambia. regardless of the status. That being said, I hope this video was helpful, and thank you for tuning in. See you on the next one.